Thank you for joining me today. My name is Courtney, and I will be presenting on cocaine. Cocaine is a powerful drug that comes from leaves of a plant called coca, mainly found in South America. It is highly addictive and classified as a Schedule II drug, meaning it's illegal to use without a doctor's prescription. Doctors may use it for certain medical purposes, like numbing during surgeries. There are two main forms of cocaine: a powder that can be snorted or injected, and a crystalline form called crack that's usually smoked. Crack gets its name from crackling sound it makes when heated. People can also mix crack with marijuana or tobacco to smoke it. People often use it in different ways: snorting it through the nose, rubbing it on their gums, injecting it into their veins, or inhaling its smoke into their lungs. However, no matter how it's used, it can be extremely dangerous, leading to heart attacks, strokes, seizures, and even sudden death. The risk is present even with occasional use. The organs affected are the nervous system, cardiovascular, respiratory, renal system, as well as the liver and kidneys. In the nervous system, the cocaine acts as a powerful stimulant of the sympathetic nervous system. It inhibits the reuptake of catecholamines and stimulates central sympathetic outflows, leading to increased sensitivity to adrenergic nerve endings to norepinephrine. This results in irreversible structural changes in the brain. In the cardiovascular system, it causes vasoconstriction of coronary arteries, atherosclerotic pneumonia, and thrombus formation, predisposing individuals to myocardial infarction. It also affects potassium, calcium, and sodium channels, leading to arrhythmias. Chronic cocaine use is associated with conditions such as myocarditis, ventricular hypertrophy, dilated cardiomyopathy, and heart failure. In the respiratory system, the inhalation of crack cocaine can cause various respiratory problems due to its pharmacologic effects, administration methods, whether through smoking, sniffing, or injecting, and alterations of the central nervous system regulations of pulmonary function. In the renal system, cocaine abuse can lead to renal failure, as documented in several studies. As far as the liver and kidney, the cocaine-induced hepatotoxicity is mediated by oxidative stress and mitochondrial dysfunction during the metabolism of noradrenaline norcocaine. Cocaine primarily affects with the part of the brain called the limbic system, which handles feelings of pleasure and motivation. It pumps up the level of chemical called dopamine, making you feel super happy and wanting more of the drug. This pleasure center is mostly in part of the limbic system called the nucleus accumbens, or NAC. Cocaine tricks the brain into releasing extra dopamine, causing intense joy. Memories of this happiness get stored in places like the hippocampus and amygdala, making you crave more of the drug. When you use cocaine a lot, it messes with the genes in your brain, especially a protein called delta FOSB. This protein tells certain genes to switch on and change the structure of nerve cells. With continued cocaine use, delta FOSB piles up in the brain, making you crave the drug even more. Studies with mice show that having more delta FOSB makes you more sensitive to drugs and want them more, but blocking it can reduce these effects. Cocaine also messes up the structure of nerve cells, especially in the neck. With regular use, these cells grow and sprout new parts, making the brain more sensitive to drug-related memories and craving. These changes can stick around for a long time, even after you stop using cocaine. Using cocaine disrupts the normal functioning of the brain's limbic system, which is responsible for regulating pleasure and motivations. When cocaine enters the brain, it causes a surge in dopamine levels, leading to intense feelings of euphoria and a strong desire to use the drug again. This disruption in dopamine levels interferes with the brain's natural balance and reward system, which is crucial for maintaining stable emotions and behaviors. Chronic cocaine use further exacerbates the problem by altering genetic activity within the limbic system, particularly affecting the protein called delta FOSB. This protein plays a role in regulating gene expression and promoting structural changes in nerve cells. With repeated cocaine exposure, the accumulation of delta FOSB in the brain contributes to addictive behaviors, making it harder for individuals to resist the drug and control their impulses. Additionally, cocaine induces long-lasting changes in the structure of nerve cells, particularly in the nac region of the brain. This results in growth and sprouting of new offshoots of dendrites, which are the branches of nerve cells responsible for receiving signals from other neurons. These structural changes enhance the brain's sensitive to drug-related memories and cravings, further perpetuating the cycle of addiction. Overall, cocaine addiction stems from a complex interplay of biochemical and structural alterations in the brain, disrupting its normal homeostatic balance. By hijacking the brain's reward system and altering genetic activity and nerve cell structures, cocaine creates a state of heightened vulnerability to addiction, making it difficult for individuals to break free from its grip. Cocaine addiction is considered a chronic illness. It is diagnosed through a combination of medical and psychological assessments. Medical professionals may use criteria outlined in diagnostic manuals such as the Diagnostic and Statistical Manual of Mental Disorders, DMS-5, to evaluate the severity and impact of cocaine addiction on an individual's life. Diagnosis often involves assessing the presence of withdrawal symptoms, tolerance, and continued use despite negative consequences. Treatment for cocaine addiction typically involves a combination of behavioral therapy, medication, and support services. Behavioral therapy aims to modify attitudes and behaviors related to drug use and improve coping strategies. Medication may be used to manage withdrawal symptoms, cravings, and co-occurring mental health conditions such as depression or anxiety. Cocaine addiction is considered a chronic condition because it often involves long-term management rather than a one-time cure. While individuals may achieve a period of abstinence or remission, addiction can be characterized by relapse and ongoing challenges. Physiologically, drug used in addiction treatment may act as agonists or antagonists to specific neurotransmitters in the brain. For example, medication like buprenorphine may act as partial agonists at opioid receptors, helping to reduce cravings and withdrawal symptoms in individuals with opioid addiction. Overall, the goal of medical care for chronic illness like cocaine addiction is to improve quality of life, reduce harm associated with drug use, and support individuals in achieving long-term recovery. For people battling cocaine addiction, scientists are investigating different medicines to help them recover. These drugs tackle different parts of addiction, like handling withdrawal symptoms and preventing relapse. Some of these drugs include propranolol, where this medication is usually used for issues like high blood pressure and anxiety, and it has been seen to be helpful for those with severe cocaine withdrawal symptoms. It blocks certain brain chemicals linked to anxiety and cravings, easing withdrawal discomfort and encouraging early abstinence from cocaine. Then you have baclofen, tiagabine, and topiramate. These drugs work on the brain messaging system, focusing on GABA and glutamate pathways. By adjusting these systems, they aim to reduce the enjoyable effects and cravings caused by cocaine, helping to prevent relapse. Baclofen targets GABA receptors. Tiagabine blocks GABA reuptake, and topiramate affects both GABA and glutamate functions. Then there is also disulfiram. Initially for alcohol problems, disulfiram shows promise in curbing cocaine use by causing unpleasant reactions when cocaine is taken. It blocks enzymes that break down cocaine, leading to higher levels in the body and less enjoyable effects. Modafinil, used for narcolepsy, boosts glutamate activity in the brain, countering the low levels seen in chronic cocaine users. By lessening the enjoyable effects of cocaine, modafinil helps cut craving and prevent relapse. Although these options show promise, there's still no FDA-approved medication specifically for treating cocaine addiction. But ongoing research and trials offer hope and better treatments in the future. Each drug may have its own side effect, from mild to severe, like dizziness, fatigue, stomach issues, or mood changes. It is vital for doctors to closely watch patients for any problems and adjust treatment as needed for best results. Ultimately, while medicines can help fight the addiction, recovery is often a mix of approaches. Alongside drugs, comprehensive treatment plans with support therapy and lifestyle changes are crucial for long-term success. There are various AI models that are now helping diagnose and treat cocaine addiction. Researchers are using machine learning, or ML, to understand physiological issues caused by drug abuse. By studying brain scans, behaviors, and memory patterns, they've learned more about these disorders. Machine learning can spot early signs of drug use, predicting future problems. Studies following PRISMA guidelines show machine learning's exclusive use in understanding substance abuse. Brain function, behavior, and activity patterns give vital clues about these disorders. Machine learning, especially random forests, is widely used for sorting data effectively, combining different data sources like interview surveys, brain scans, and digital tools improve diagnosis and treatment planning. But challenges remain, and future research need long-term studies with clinical validations to refine machine learning models and find new ways to tackle substance abuse.